Welcome everyone, and thank you for joining us for the Food and Beverage Marketing in Schools webinar. We're so glad that you could all join us today. My name is Allison Lipsett-Simpson, and I'm the Education Specialist at Penn State PRO Wellness. Joining me today is Caitlin Merlo from the Centers for Disease Control and Prevention and Sally Mancini from the UConn Rudd Center for Food Policy and Obesity. Caitlin is a health scientist at the Centers for Disease Control and Prevention's Division of Population Health, where she serves as the lead for school nutrition. She develops science-based guidance and provides technical assistance on strategies to improve the school nutrition environment and support healthy eating among youth. Caitlin has worked at the CDC for the past 7 years. She is a registered dietitian and earned a Master of Public Health degree from the University of California, Berkeley. Sally is Director of Advocacy Resources at the Rudd Center for Food Policy and Obesity, leading efforts to inform the public, community organizations, advocates, and policymakers about the center's research related to food marketing to children and its impact on health disparities. She also helps state and local advocates develop the resources necessary to support food policy improvements in all communities. Sally earned a bachelor's degree in international affairs from Gordon College and a Master of Public Health degree from the University of Connecticut. This webinar would not be possible without the support of our funders. Funding was provided by the Pennsylvania Department of Health through the State Public Health Actions to Prevent and Control Diabetes, Heart Disease, Obesity, and Associated Risk Factors and Promote School Health Federal Grant, and Preventative Health and Health Services Block Grant from the Centers for Disease Control and Prevention. We'd like to give a special thanks to our partners at the Pennsylvania Department of Health for their contribution to this webinar. A few housekeeping points before we get started. All participant phones and microphones have been muted to ensure the information shared by all presenters can be heard clearly. If you would like to submit a question or a comment for the question and answer session, you can enter that into the questions box. We will reserve time at the end of the webinar to answer any submitted questions. This webinar is being recorded, and a link to the recording and handouts will be emailed following the webinar. A link to the follow-up survey will also be included in this email. To receive your certificate of completion, you will need to complete the survey, which you will see upon completion of your survey, and you'll be directed to the certificate. So a little bit of information about the PRO Wellness Center. At PRO Wellness, we are committed to educating and inspiring youth and their families to eat well, engage in regular physical activity, and become champions for bringing healthy choices to life. Our vision is to reduce the incidence rate of childhood obesity. We aim to be the trusted resource for educational programming, collaborative partnerships, and proven interventions in schools, communities, and like-minded organizations. We pride ourselves on being a great resource for schools and their partners. The PRO in our name stands for Prevention, Research, and Outreach, and examples of our work based on this acronym can be found on our website. Our website also has many resources, including the opportunity to sign up your school or community-based organization to be a healthy champion. Our Healthy Champions program is available for schools in Pennsylvania. Annual registration is required to receive your welcome kit at the beginning of each school year. Registration begins each spring and is currently open. There is no limit on how many schools can enroll, but the welcome kits are limited. But all Healthy Champions do receive free resources like event planning guides and promotional templates, customized school champion reports, future funding priority, which means that you'll find out about new grant opportunities first. And for our local champions, you'll receive special incentives like our incentives with the Hershey Bears. To register your school, you can go to the link that you see right there, pennstatehershey.org/prowellness/champs. As a Healthy Champion, your welcome kit will include posters and expanded resources for our 4 signature events, which are Apple Crunch in October, Walk To and At School Day in October, Go for the Greens in March, and Move It Outside Day in May. So log on to our website for more details on the program. So let's get started talking about food and beverage marketing in schools. At the end of today's webinar, attendees should be able to recognize what food marketing looks like in schools, understand why it's important to address food marketing in schools, and identify tools and resources available to help assess food marketing in schools. And so with that, I'd like to turn it over to our speakers, Caitlin Merlo and Sally Mancini. Caitlin, you are up.
Great. Thanks so much, Allie, and good afternoon, everyone. Sally and I really appreciate the opportunity to talk to you all today about a really important topic, food marketing to children. Many folks may not realize just how much food marketing there is out there and how it influences not only what we purchase and but also what children want to eat. So in this presentation, we will focus on marketing to children in schools. But first, we'd like to get some information from our audience members. And so we have a poll question for you. And the question is, how familiar are you with food marketing in schools? Are you very familiar with this topic and have experience working to address food marketing in schools? Are you familiar with the topic but have not yet addressed it in the school setting? Do you know a little bit about it but would like to learn more? Or are you not very familiar with it and this is your first time learning about it? So we'll just wait a couple of seconds for folks to fill out the poll.
We still have people voting, so we'll hang on for just another second here before we post the results. All right, it looks like we've slowed down. So any last minute votes, plug those in. Oh, there we go. Almost everyone has voted. Okay, so we'll go ahead and close the poll. And I am going to share the results with you. Caitlin, if you want to talk a little bit about this, you can.
Great. So it looks like there's a good mix within the audience. Some folks have a lot of experience working on this topic, and some are new to the topic. So we hope that at the end of this webinar, everyone will leave with some additional ideas about how to approach this issue of food marketing in schools in your work.
Great. Let's get back into here. And Caitlin, I am going to turn this over to you. You should have the ability to move your mouse now.
Great, thanks, Allie. So I'm going to start out by just providing a little bit of background information, and then I'm going to turn it over to Sally to really dig into some more specifics around what food marketing looks like in the school setting. So we know that in the United States, very few children are meeting the recommendations for healthy eating. One example is that nutrition experts say that no more than 10% of kids' food intake should come from empty calories, which are the calories that are from solid fats and added sugars. However, on average, children in America get almost half of their calories from empty calories. And the top sources of empty calories are desserts, pizza, fruit drinks, and soda. We also know that most kids are meeting the recommendation for fruits and vegetables each day. Just 4 out of 10 kids eat enough fruit, and fewer than 1 in 10 eat enough vegetables. Research shows that food marketing influences children's purchase requests, which means what they ask their parents to buy for them, also their preferences and their dietary intake, and it's one contributor to unhealthy diets. The truth about food marketing is that the food industry spends almost $2 billion a year to market foods and beverages to children. And as you can see from this graph, most of this money is spent on sugary drinks, sugary cereal, sweets, snacks, and fast foods. And less than 1 out of every 100 food marketing dollars is spent on healthy foods like fruits and vegetables. So how much food marketing is happening in schools? Research shows that most students are exposed to at least one form of marketing during the school day. And the most recent data, which is from 2009, shows that food and beverage companies spent $149 million on marketing foods and beverages in the school setting. These foods and beverages that are advertised in schools are typically of poor nutritional value, and beverages make up the majority of in-school marketing expenditures. CDC's School Health Policies and Practices Study, or SHIPS, is a national survey that's periodically conducted to assess school health policies and practices. The 2014 SHIPS study included data on school and classroom level information, including food marketing. In 2014, nearly 1/4 of schools reported that they allowed soft drink companies to advertise soft drinks on vending machines. Over 6% of schools allowed it in school buildings. 8% allowed this type of marketing elsewhere on school grounds, and 1% allowed it on school buses. Additionally, almost 6% of schools allow advertisements for junk food or fast food restaurants on school property. 4% of schools use educational materials that feature junk food, fast food restaurants, or soft drinks. Almost 4% of schools promote junk food, fast food restaurants, or soft drinks through the distribution of products like t-shirts, hats, or book covers to students. Almost 37% of schools hold fundraiser nights at fast food restaurants, and this has actually increased significantly since 2006. And fewer than half of schools prohibit or actively discourage staff from using food or food coupons as a reward. So this data provides a snapshot of what is happening in schools nationwide. And as you can see, there are lots of different types of marketing that are happening in schools. And it's also important to keep in mind that these data are based on self-report from the school administrators. So in some cases, the results may actually underreport what's actually going on at the school level. Another recent study showed that 2 out of 3 elementary schools, food companies offer coupons to children as rewards. 3 in 10 high schools serve branded fast food every week, and 2 in 10 serve branded fast food every day. And 7 out of 10 elementary and middle school students see food marketing in their schools every single day. So as you can see, there's a lot of food marketing happening in schools, and the type of food marketing may vary depending on if it's at the elementary, middle, or high school level. This is a concern because advertising unhealthy foods and beverages in the school setting is contrary to health education curricula. It creates inconsistent messages for youth about healthy eating, and it can promote unhealthy dietary choices. So I'd like to now turn the presentation over to Sally Mancini from the Rudd Center to talk a little bit more about the various forms of food marketing and how we can begin to address them in schools.
Sally, you should have control now, so if you want to try and move your mouse.
Okay, thanks, Allie.
Welcome.
And thanks, Caitlin. So I'm going to start out by giving an overview of the types of food marketing that you may see in schools. When children are at school, we expect them to learn about math and reading, but many times they also see marketing for soda, candy, fast food. And the question we're looking to answer here is, do unhealthy brands belong in a place of learning? Now, the U.S. Department of Agriculture defines food marketing as advertising and other promotions in schools that include oral, written, or graphic statements made for the purpose of promoting the sale of a food or beverage product by an entity with a commercial interest in the product. So where exactly do kids see food marketing? And as Caitlin just said, the forms of food marketing in schools vary depending on the level in either elementary or secondary. I'm going to start out by showing some examples of food and beverage companies donating educational materials to teachers free of charge to use in their classroom. And children see these materials and build preferences for these products. At the Rudd Center, we've done a lot of research on targeted marketing to children of color. And because these materials are free, we found that lower income schools use them more often. We also see products in schools encouraging kids to read, just, such as this coupon or incentives. Companies provide these coupons to schools, and children receive a free or reduced price meal at a restaurant in exchange. We also see companies sponsoring sports and other extracurricular activities on school grounds. And this is one of the most visible forms of food marketing. But it's concerning when unhealthy products are featured on athletic fields, in school hallways, cafeterias, and vending machines. Then these are the same products that teachers and health professionals are telling students are not good, that are not good for their health. We also see branded food and beverage sales in the school setting. And it's important to note that since the 2014-15 school year, products sold in schools, in vending machines, on the school lunch line, the a la carte items, they must meet the USDA Smart Snack Guidelines. And so some of the products within the vending machines may be changed, but the marketing on the vending machine itself is still visible to students and still marketing unhealthy foods and beverages. And we even see branded food fundraisers in the school setting. And this is, Caitlin mentioned this just a few minutes ago, that 36.9% of schools participate in branded food fundraisers. And again, it can be confusing to children to learn about what and how they should eat in health and nutrition classes, only to turn around and find schools are promoting sugary drinks, non-nutritious foods through fundraising. So why do food companies target kids at school? And again, this is an area of research that the Rudd Center has done quite a bit of work on. And we've delved into the reasons why companies choose to advertise to kids in schools. And number one, kids are a captive audience within schools. There are 30 million students in elementary, middle, and high schools around the country on any given day. We also know that it can be great for public relations for companies. Educational and charitable programs create positive feelings about companies. Most schools and parents view them as a public service, but companies see them as an inexpensive and effective way to market their products to children and teens. And we also see schools and teachers endorsing brands, and these messages imply that they approve of these products, again, sending mixed messages to students. But most importantly, marketing in schools is a very effective tool in companies' efforts to create lifelong loyal customers. And I'll just read these two quotes to you from advertising executives. It isn't enough to just advertise on television. You've got to reach kids throughout their day, in school, as they're shopping at the mall or the movies. You've got to become part of the fabric of their lives. And the other quote, they aren't children so much as what I'd like to call evolving consumers. So we see that food and beverage companies are actively advertising and marketing unhealthy foods and beverages to children throughout the day and even in school. But that brings up some interesting questions. Don't schools need the money for fundraising? What we've found from the research is 2 out of 3 branded fundraisers raise no money at all for schools. And vending machines provide just $2 to $4 per student per year. And at McTeacher's Night, schools get as little as $1 per student. Now, this is always one of my most controversial slides, the Box Tops for Education program. And many schools offer this fundraiser. Students bring in the Box Tops for Education and raise money for their schools. But did you know that a school gets just 10 cents for every box top? And that means if parents would buy 50 boxes of Lucky Charms for more than $150, the school only gets $5. So what do parents think? 2 out of 3 parents support limits on marketing in schools, and most school officials also support limits. Over 7 out of 10 parents support setting nutrition standards for food sold for fundraising. The Rudd Center does a parent survey annually, and we found that parents are as concerned about junk food marketing to their children as they are about alcohol and tobacco use in the media, and their concern is increasing. But it doesn't have to be this way. There's many healthy fundraising options available, and you'll see a few here: walkathons, dance-a-thons, book fairs, art shows. So there's many ways to raise money without selling unhealthy foods and beverages. Now we see that changes are starting to happen. States such as Maine and Nevada have laws about marketing unhealthy foods in all public schools, and school districts like San Francisco are setting policies to get rid of food marketing in schools. And all local school districts can set guidelines to limit food marketing in their schools through their school wellness policies. So in 2014, the federal government proposed new school wellness policy guidelines. And these guidelines would require each district's school wellness policy to include a provision allowing the marketing and advertising of only those foods and beverages that meet nutrition standards for food sold in schools, the Smart Snack Guidelines, which I'll talk about in more detail in a second. And the final rule will most likely be released this year. So what are the nutrition standards for food sold in schools, or the Smart Snacks in School standards? Schools, to be able to sell food in schools, the snacks must meet these standards, be a whole grain rich product, or have as the first ingredient a fruit, a vegetable, a dairy product, or a protein food, or be a combination food that contains at least a 1/4 cup of fruit and or vegetable. So these Smart Snack Guidelines are the guidelines that the school food service directors are using for the a la carte items that are sold in the lunchroom. And these are the same guidelines that the USDA is proposing to include in the school wellness policies as the guidelines to, for food and beverage marketing. So if a product did not meet Smart Snacks in School standards, it would not be able to be marketed in the school setting. Oh, and I forgot to share that state and local laws can be more stringent than the Smart Snack Guidelines. Now, what can school health professionals do? They can assess the food marketing environment in schools, and the Rudd Center has a Rudd Roots parent site where we have food marketing in schools is a section, and we talk about assessing the food marketing environment in schools. You can visit the website anytime. The CDC also has a school health index that addresses food and beverage advertising and promotion, including coupons and contests, fundraising nights, and marketing on school property. So the School Health Index is an online self-assessment and planning tool that schools can use to improve their health and safety policies and programs. The School Health Index enables schools to identify strengths and weaknesses of health and safety policies and programs and develop an action plan for improving student health. So this is one of the tools that you can use to assess the food and beverage environment in your school. I'm also going to share information about California's Project Lean School Food Marketing Assessment Tool. And this is, in essence, a walking tour of the school along with interviews to capture the food marketing environment. And I would suggest using a digital camera to capture examples if possible. It's also good to involve students and teachers in this process, such as student council or maybe teachers that are interested in food policy issues in the assessment, and of course provide background and information to school personnel that the assessment is being conducted. So just to give a little bit more information on the assessment, the tool allows you to record the location, the description, and quantity of the marketing, both healthy and unhealthy messages that are happening throughout the school. There's in-depth information that you can collect on vending machines, marketing and product types, equipment with food and beverage names and logos, and the questions for the principal or other school personnel are based on school-based TV programming, product tests, taste tests, giveaways, activities, events, fundraisers. And just continue on with some of the questions. The money raised by school groups through vending machines, school stores, or snack bars. Curriculum created by food and beverage companies, sponsorships or scholarships. And lastly, it asks the question, does the school or district have a policy regarding advertising or marketing? And is that policy a written policy or a verbal policy? Which is very important to find out as you're collecting this information, to have a baseline assessment on a school or many schools in the district, on-school food marketing is really the first place to start when you're looking at influencing policy changes in this area. So what can school health professionals do to help improve their district's wellness policy? Well, first and foremost, schools have broad authority to control the commercial messages on campus. And school health professionals can help create a school district wellness policy restricting food and beverage advertising. There's 3 options that a district could choose in their wellness policy. You could choose to ban all advertising on campus, which would be the most strictest form of the policy, or you could ban the advertising of all foods and beverages on campus. Or the third option, and it's the option that aligns with the Hunger-Free Kids Act of 2010 and the Smart Snack Guidelines that I talked about earlier, would be to ban the advertising of those foods and beverages that the district does not allow to be sold on campus. So there's many resources available for school health professionals on model school wellness policies. The Rudd Center has a school wellness policy model that districts can use, and it doesn't just touch on school food marketing, but it looks at nutrition and education promotion, nutrition standards for all foods served on school grounds, competitive foods and beverages, fundraising, and also physical activity. Another resource is through Change Lab Solutions. They have a district policy restricting food and beverage advertising on school grounds, and it's a policy specific to food and beverage marketing. They also have a resource on First Amendment rules, which is really helpful to read through and to gain an understanding on as you're embarking on this process. The Alliance for a Healthier Generation is also a resource not only for model wellness policies, but how to create a school wellness committee that's representative of the community and is able to make changes, the most broad-based changes in this area. And lastly, the Rudd Center has a tool called the WellSat 2.0 that will assess the quality of a school district's written wellness policy, including food marketing. So it's an online tool that you can put your wellness policy, your current wellness policy into, and then it will give you suggestions based on model policy language on ways to strengthen the district policy. So you'll see here we shared our sources, and then I just want to say thank you for attending this webinar, and we are happy to answer any questions and to delve into any of these issues much deeper now.
Thank you so much, Caitlin and Sally. That was great, and we have lots of time for questions, and we have some coming in now. So just as a reminder to use the chat box or the questions box to go ahead and put your questions into, and Sally and Caitlin will be able to answer. You can ask any questions, and it looks like we will start with one that came in, and it says, and what I'll do for everyone is that I will read the questions to Sally and Caitlin, and they'll have the opportunity to respond. So please go ahead and continue to put your questions in the chat box. This first question says, when students are served generic foods or foods with plain wrappers, they think it is lower quality. Some foods are branded to show the students that the quality of the product they are getting is equal to what they get outside of school. How do you suggest districts proceed in communicating that we have quality products to students? It is unrealistic to suggest that foods are not branded. So do you guys want to take a shot at answering that?
Sure. This is Sally, and I agree. I think that we're looking at ways to work with either state agencies or others that are helping to brand foods in healthier ways, or to use messages that resonate with with kids along the lines of healthier for healthier products. So we're exploring that issue. We've been looking at the changes in the Smart Snack Guidelines and how that's impacted purchases of snacks within schools. What's happened, as what we've seen though, is most often companies have reformulated their products to meet the Smart Snack Guidelines and are still using the same very similar packaging for their products that are being sold in schools. So we want to move towards marketing products that are only healthy. And one of the things that has been suggested is only allowing companies that market healthy products to kids have a presence in schools. So there's still the branding going on, but it's for healthier products across the board. So if a child walks into a grocery store and sees a similar product that they would see in the school, then they're guaranteed that it's probably healthier than some other products that they may see. So it's I think looking at the way kids how they want to purchase things and branding really healthy foods such as apples and carrots in a fun, exciting way is really important moving forward.
This is Caitlin, and just to add on to what Sally already mentioned, I think, also how, not only how it's packaged, but just how healthy foods are promoted is important too. So some of the strategies that the Smarter Lunchrooms movement suggests is, having a beautiful fruit basket with pieces of fruit, and those aren't packaged products. They can look really nice and attractive if they're placed well and placed, in a nice serving dish and things like that. So I think there's kind of two ways to address the issue, but definitely working to improve how we present healthy options to kids is really important.
Great. We have another question, and the question is, how can we encourage or influence food manufacturers to produce healthier foods for all consumers? Getting them on board would enable all family members to eat and have healthier choices. So what are your thoughts on influencing food manufacturers to produce healthier foods?
So this is we're talking across the board now, right?
Yes, I think that's probably how you take this question.
Sure. Well, here at the Rudd Center, what we do is we look in depth at a specific type of food. So we've done reports on sugary drinks and cereals, snack foods, and whole range of reports. And one of the reasons why we do these reports is we're able to see which companies are marketing the most and which are doing the best job in marketing healthy products to kids. So we work in coalition with a group called the Food Marketing Work Group, and we encourage companies to market in better ways. So we'll call companies out as a coalition through this Food Marketing Work Group, encouraging them to not only market healthier foods and beverages, but to change their standards as far as nutrition is concerned. And we are constantly pushing food manufacturers to go that extra step. And so there's a lot of work that we've been able to do collectively through this work group, through the Food Marketing Work Group. And if you're interested, you can Google it and find it online and sign up for more information and see how you can become involved as well. I think what we've seen in schools with the Smart Snack Guidelines, they're great guidelines that the USDA put out, and provide nutrition standards that are just at a much better level than what we had seen prior. And companies were able to reformulate their products to make healthier options for kids within the school day. So standards, having really strong standards and continue to push those standards to align with what we know science is telling us and the dietary guidelines for Americans is telling us. And then when we are able to put those policies or those standards into policy, then we see the food and beverage companies stepping up to the plate. But it takes time. It's a process.
Great. Caitlin, do you have anything to add to that?
Nope, that was a great response.
Wonderful. So we had another question that came in, and it said, I think it goes back to a little bit of the first one. If a product meets the guidelines, why don't you consider them healthy? What is your definition of healthy? And are you using different guidelines, or do you consider all processed or packaged foods to be unhealthy? So combo question there, and if you want me to read it again, I can.
So what we're looking at is that the brands that are marketing in schools they're marketing themselves as a brand, and most likely they have unhealthy products. While the products that are being sold in the school day meet these Smart Snack guidelines, these companies have many other products that don't meet those guidelines. And so it can be very confusing to parents and to students when they see a specific company being marketed within the school day, and then knowing that they have products that do not meet the guidelines for snacks that are sold in schools or food that is sold in schools. So I think that's where the double standard comes in. And there are some of the examples that I gave. There are companies that have very few healthy products that are still marketing themselves within schools, and so kids are seeing ads for specific products through educational coupons or incentives or materials, and they're building these brand preferences. It can be very subtle, even if there's not information specifically being shared about the product. The fact that it's there within the school building, and these are unhealthy, quote unquote, unhealthy brands, then it's concerning to us.
And this is Caitlin, just to add on to that, as Sally mentioned, a lot of this marketing is not necessarily of an actual food product that's being sold at the school, but it's marketing that's happening for things outside of the school day. So what that could be a coupon as a reward that then the student takes to a restaurant for an unhealthy treat afterwards. So they're not necessarily selling that food in the school setting, but the product is still being marketed to kids in the school setting. And same thing goes for fundraiser nights at a fast food restaurant or big teacher nights and things like that. Those aren't necessarily occurring in during the school day, but kids are getting that message that, well, this must be a good thing to do outside of the school day.
That's wonderful, and great answers. Sort of to talk a little bit about the fundraising, and this is more of a question of mine to you all. We did a healthier fundraising webinar because it's a topic that we hear from schools a lot that they're interested in as they change wellness policies, and they're moving things around and they want to make some of these shifts. And Sally, you had a great slide up, and I was wondering if either one of you, both of you, could talk a little bit about some of the ideas that maybe were on that slide, or some of the great fundraisers that that have helped to replace some of those unhealthier fundraisers. Because again, I know for our schools, it's those kind of things, those tips and suggestions that really go a long way. So could you guys talk a little bit more about the fundraising options or other fundraising alternatives?
Sure. Again, the examples that were on the slide were walkathons and dance-a-thons. I think there was an art there, an art fundraiser and some healthier food fundraisers, fruit baskets. So really the sky's the limit when you start thinking of all of the options available outside of just foods and beverages. And I know at my children's school we did a short run, and it was really just right around the school. And we were able to record how many laps that a child did around the school, and they raised money for the PTO in that way. And it was really fun to get families and kids out moving, running around, and enjoying being outside and being active while also raising money for the school. So I think that it's really great to be creative in this area, and there are, I don't know of a lot, but I think there are pre-packaged healthier fundraisers as well. We know that you can sell bags or wrapping paper, things that are outside food and beverages as well. But to think about active fundraisers, I would encourage schools to go that route because it can be a really great family fun event as well.
Thank you. That's great. Again, our schools are always asking about ideas, so we are always open to hearing more. We have a couple more questions, and one of them is, what are some ways you can work with others in your district to address unhealthy food marketing in schools?
Okay, this is Sally again. I'll take that on, and I think that goes back to the school's wellness policy or the district's wellness policy, as well as the wellness committee or council that a district may have. I think it has different names and different locales, but through the Child Nutrition Act, each district through the United States Department of Agriculture is required to have a school wellness policy and a school wellness committee. Now, some are more active than others, but these committees are a perfect place to start talking about food and beverage marketing and other opportunities for improving the health and wellness of the district and for the students and even the teachers. There's district policies that address wellness, teacher wellness, and professional development in this area as well. So there's a lot of opportunities through the wellness policy and the wellness committee process to make changes. And I really encourage participants to look at the resources that we provided because they've, especially Alliance for Healthier Generation has a step-by-step resource on how to bring together a school wellness committee, how to look at the policy. And one of the cities here in Connecticut is using their resource right now to improve their health and wellness policy. So it's really exciting to see the work that can be done at the local level around these issues when there's interest, when you have the right people around the table, and you have some buy-in from administration, and so it's a very exciting thing to see happen.
And this is Caitlin. I would second what Sally said about the Wellness Committee and the wellness policy, and keep in mind that in the proposed rule for wellness policies that USDA has published, there is language in there about including a provision in the wellness policy related to food marketing. And so, the final rule should be coming out shortly, and we will see exactly what that language says. But it's a great time to start kind of getting ahead of the curve on this issue and thinking about, what that language in your wellness policy would look like if you want to address food marketing and have it align with the USDA requirement. And I think, in addition to the policy work, there's also ensuring that policy is implemented at the school level. And so, doing some sort of assessment, whether that be the School Health Index or the California resource that Sally shared, that's another great way to kind of come together as a team and take on that assessment piece so that it's not just one person responsible for all of that. So the policy and the assessment are great ways to work collaboratively to address this issue of food marketing in schools.
Wonderful. I don't think we have any questions that have come in, and I think that's a great way to end. But I would like to take a moment and thank Caitlin and Sally for being on the webinar with us today. We are so appreciative that you would take the time to do this and share your information. As a reminder to our participants, you will be receiving an email after the webinar within the next few days with a survey. If you requested a completion certificate for the webinar, you will need to take the survey in order to receive that completion certificate. And if you have any questions, as usual, you may connect with us. There's a slide up that gives you the ways that you can stay in touch with the PRO Wellness Center, and we are welcome any questions that you may have or comments, and we look forward to hearing from you. Thank you again to Caitlin and Sally, and we hope you all have a great afternoon.
Thanks, Sally.
Thank you.
Thank you.